Hi, my name is Dr. Mandy Johnson, and I am here talking to you today about some of the struggles that I see commonly with people as they encounter low back pain. I'm currently a practicing physical therapist here in Maryland and Virginia, and I've been treating people for about 6 years. Low back pain is one of those really scary topics that people really struggle with. It's one of those things that you're just not really sure if that's something you can get over or if that's something you're going to be stuck with for the rest of your life. You have those people that have histories of low back pain in their family, and so the thought that they might have their dad's low back is really weighing heavy on their mind, or just, can I get back to playing with my kids? Low back pain can really be something that keeps you away from doing the activities that you want to do and that you need to do to have a great, healthy life. One of the biggest problems I see is everyone's hinging on needing to get some sort of picture of your insides. So by that I mean an x-ray or an MRI or a CT scan, and that you won't ever really know what's going on and know how to fix it if you don't get that picture. And the main reason why that's just not the thing to hang your hat on is that there's a lot of research out there, and there's a lot of people out there that I've seen and I've treated that never got a picture of the inside and did great. The truth is, the majority of people will experience low back pain at some point in their life. And it's one of those things that's more, should be seen more as a sign of something's a little off. So I had this really great clinician that always used to tell her patients, pain is the last thing that comes. So people will talk about, like, oh, I was just bending and lifting something, or oh, I just reached down to grab that piece of paper off the floor, or picked up my kid and I just felt this in my low back. And they see it as this all of a sudden event. And the truth is that it was a building event. There are things that changed about your life slowly, that you aren't exercising as regularly, that you aren't stretching at all, that you're sitting a lot and taking that time off at the end of the day to collect your thoughts, and maybe you're just watching TV. And all of those components stack up in your body. The lack of getting out there and making that body challenged through exercise, and not stretching like we should so that we can reach down and not pull our hamstring or overtax the back because our body's not going through that range of motion anymore because you're just not doing it. Those are all really normal things. As we age, we just stop taking time for ourselves. So that low back pain that you've just experienced, maybe for the first time, is not something that should scare you or should make you feel like you've got to run to that local, provider and get that X-ray, that MRI. There are reasons that those things exist, of course, and they're great, and we should use them. Just don't hang your hat on it. Again, it just doesn't always reflect how your pain is acting and whether or not you can get better. Well, obviously, because I'm a physical therapist, I'm going to recommend that it'd be great if you could see a physical therapist. I really think that there's a lot to say about getting in and getting moving as soon as possible, and that's also backed up with lots of different information. So if you want to go talk to or text or email a physical therapist, chiropractors out there as well. We're all out there to try to get you there and get out and get you back moving as fast as possible, because that is really the key to health. Use that as a wake-up call to say, how am I treating my body on a regular basis? How am I treating that body that I'll have in the future, and making sure that future self is valued now with my choices. All right. Thanks so much.